everyone. I want to welcome you and welcome Kelly McClain to the Best Specialist of Rome podcast. I'm going to tell you a little bit about Kelly and then we're going to get to know her. So, Kelly has been a physical therapist for 30 years, which is really awesome. She also has a degree in psychology, so she brings a different level of education to her treatment and philosophy. She moved here to Rome in 2006 and raised her three children. Things she has accomplished in her career as a physical therapist, especially specific to her being a pelvic floor therapist. She's Herman and Wallace trained. She's also trained in visceral mobilization of the GI system and the bladder. She has advanced training in male pelvic floors, pediatric pelvic floors, pain science, stress urinary incontinence, and pessary fitting. So she has a wide breadth of knowledge about pelvic health and pelvic floor physical therapy, and I'm excited to have her. So welcome, Kelly.
Thank you. Thanks for having me. I'm excited to be here.
Awesome. All right, so I'm gonna break the ice with the easy question. What made you decide to be a PT?
Oh my gosh. Should be the easiest question ever.
Right?
It wasn't because I had sports injuries as a kid and growing up, or that I really knew anybody. I actually just volunteered in our local hospital, um, and like on the weekend and like some over the summer, and just was able to get to see a lot of the different areas of the hospital and different kind of specialties and what went on. And the the day I got to go to the PT floor to help out, it was like game over. That was it. It was just like, I cannot believe I just found my calling. So
That's
that's how
awesome.
that all started.
That's awesome. What are some of the most common issues that you encounter in your practice as a pelvic floor therapist?
Yeah. So with pelvic floor physical therapy, a lot of people don't know a ton about pelvic floor physical therapy. It's really just kind of um, sprung to the forefront um, of issues and areas of PT. When I was in school, we didn't learn much about it back then, other than it's a thing. And if you ever decide you want to do it, you will need to go get, you know, advanced specialist training.
Right.
So fast forward years later, that's what I did. So lots of training, just over years and years of that, in addition to PT school, and. I feel so fortunate to be able to get to treat people for issues that they might not talk about all the time, or that aren't visible necessarily, like we don't have a sling on, we don't have a knee brace, things like that. And those issues are bladder leaking, which is very common, and common does not equal normal. So
Right.
it's great that we can have interventions that people don't have to just live with bladder leaking. We know that bladder leaking affects like 50% of women, and men too. But for women, it really stops us from getting from exercising.
Right.
It's an issue that can really impact our overall health. So bladder leaking, any bowel or GI issues. To me, bowel issues are constipation is enemy number one of the pelvic floor. And so we treat that as well in our office. Pelvic pain, any kind of pelvic pain, regardless of the origin, we want to investigate that, find out what the root cause is. Back pain, abdominal pain, hip pain, that as it relates to the pelvic floor, those areas are just connected right there. So sometimes we are, having overlapping pain conditions. Pregnancy, for people that just want to have a birth prep and have, just a healthy pregnancy, we can guide them through that. Sometimes there's issues, musculoskeletal and pain issues in the pelvis
Right.
that come up during pregnancy. Same with postpartum, like after you have your baby, that's a huge transition time as well. pelvic organ prolapse, like I mentioned. So those are all the big things that we see in our office.
Yes. So I'm going to say you are the anything that's in the pelvis specialist.
Yes,
And that can be a lot of different things, but anything
that,
that sits in those hip bones.
that sums it
Um,
up.
yeah. If you could stack any one type, so all those different things that can happen with your pelvic muscles and pelvic organs, if you could stack any one type of diagnosis or type of client on your schedule because they're the most interesting, you're really good at it, and it's what you want to be known for, what would that kind of person be?
Gosh, that's a tough one.
Yeah.
A lot, what we know in pelvic health and what we see in our office is a lot of the issues actually overlap.
Okay.
So we, if we have bladder issues, we also oftentimes discover that there is a GI component that is contributing, or a pelvic muscle overactivity, or a weakness. So it's not just about doing Kegels all the time.
Yep.
In fact, that can be counterproductive for some people, just depending on what they have going on. So my favorite, gosh,
Yes.
um, I just have to say all the above. I just
Oh,
have to
yeah.
pick D. I mean,
Yeah.
answer D, like all of the above.
I think
Um,
that's fine. You are already, you're pretty niched down with pelvic health, so I think that's great. Um, all right. What does the journey look like for someone to know when they should come to see a pelvic floor physical therapist?
yeah. Um, well, if you have inklings that like something's just different, not right, changed down there. So I say, we care for your issues down there. So if something it just has changed, oftentimes we see that around pregnancy, postpartum, perimenopause, and menopause age. Or if you notice you're leaking, your bladder's leaking more, you have pain that is new or different, all those are indications where an assessment and evaluation by a pelvic floor PT would be indicated. So I would say, gosh, if when in doubt, like let's assess it and see what's going on. We have a little screen sometimes that we'll use, like a little questionnaire, that is, a good potential indicator. If you check off these boxes of this particular questionnaire, you could probably benefit from pelvic floor physical therapy.
Okay.
Most people can probably benefit from pelvic floor physical therapy. I
Mhm.
mean, you go to the dentist every 6 months to get your teeth cleaned. Like, we probably ought to be checking all the things out.
Right. That's great. Um, when you have a client in front of you, when do you recommend a more conservative approach versus medical interventions and surgeries?
Yes, awesome. So, in our office, really, we are considered the conservative management for any kind of pelvic issues. And I always like to, tell patients, let's give the conservative treatment, a really good chance.
Yeah.
And most people respond really, really well to conservative management of their pelvic issues.
Okay.
If we've got someone who has, a more significant pelvic organ prolapse, that is, just beyond the conservative management, oftentimes I will, sort of refer them back to their gynecologist or to a urogynecologist in order to, sort of evaluate for, cervic or surgical management.
Okay.
Yeah, that's typically when that happens, or if we've got some kind of a nerve issue that isn't responding well to conservative management. I might refer out to their orthopedics or neurosurgery or something like that.
So you're able to kind of screen like what are red flags that, hey, this is not typically something pelvic health physical therapy is going to help in
Yeah,
conjunction with the person who can help them.
Exactly. So yeah, so we do our full evaluation and assessment, really a whole body assessment, because everything's connected, and we really want at our office. In particular, we like to take a whole body approach to the person that comes in to see us for help, and so we do all the system assessments, and then as we are evaluating and treating some, if there are things that are just not improving, or anything that's just kind of outside of our scope, then we do refer out. And I have got a good list of referral sources to send patients to.
Okay, that's awesome. So the person that is appropriate for pelvic health physical therapy, what does the process for recovery look like for someone like that that maybe is struggling with urinary incontinence?
Yes. So when people come in to see me, we do a really thorough head to toe evaluation, like I was saying. So I want to find out, in particular with this urinary incontinence, I want to find out what the drivers are. What are the contributing factors to this individual's symptoms, because it's not going to be the same for everyone. There's no protocol here. So I want to find out what is this person's root cause of their issues. And then once we identify that, we can go about starting that treatment process. And so that can look like some manual therapies, that can look like some exercise therapies, that can look like lifestyle management and changes there. So all of that is kind of, areas where we will focus in order to get this person back to, and hopefully even better than they were before they came in.
That's awesome. So it's very comprehensive, looking at all those different factors.
Yes, I look at, so yes, it can be issues in the tissues, and oftentimes it is, but oftentimes it's also, what we're eating, what we're drinking, what about our sleep, what about our other areas of the body, what's our activity level like, all those things. So we look at all that in order to really have the whole body approach, and we really get great results by doing that.
That's awesome. Do you have any patient success stories that you could share that stand out that highlight that comprehensive,
Gosh,
within HIPAA, obviously, but just, Mary.
um, oops, okay, there we are. Um, so yeah, gosh, let's think. I've had, as far as pelvic pain goes,
Okay.
um, patients that have, that come in and they've not been able to, they've maybe been to 7 different doctors, and they have not been able to get to the root cause of what is going on. They've been on a bunch of medications, they've been offered surgeries, and maybe the pelvic pain is, they're not able to have intercourse with their spouse, or they can't, have a hard time even like wearing clothes just around, anywhere around their pelvis.
Okay.
And we've, had people that are like, their life has been changed by pelvic floor physical therapy, in that we've been able to identify those specific contributors to their issues, and then gone through a whole treatment program, and they have been able to, get back to normal activities, have pain-free intercourse, be able to get back to work, be able to wear clothes again. It's really can be super impactful.
That's awesome, and something that a lot of people wouldn't even know where to start to deal with.
Right.
You can help them.
Yes. And on average, there's studies out there that say, oftentimes patients have been to 7 different other providers before
Wow.
they get to us, and they're just
Wow.
exhausted by that
Right.
point, and they just have lost hope. And so that's the biggest thing that, I would like people to know too, is there is hope. You could have been dealing with something for, decades, years and years and years, or it can be something that's newer, but it's never too early to seek out pelvic floor physical therapy, and it's never too late. So, and there's no age range, right? So we see
Right.
patients just over the course of their lifetime and are able to help them with all of, all those issues there. And if, like we talked about earlier, if it's something that is, beyond our scope, we are easily able to refer them to the right place.
That's awesome. I love all your little phrases. One we like to use is be a hope dealer. And it sounds like you're dealing a lot of hope over there.
Yes, I love that. Yeah,
Yeah,
hope
it's a good
dealer.
one. Um, all right, kind of shifting gears. What advice would you have for an individual who's looking to prevent pelvic floor problems, especially someone who's active, maybe doing CrossFit or running?
Yeah. So, oftentimes I think, man, I would love to prevent issues and be able to keep someone from having to get to the point of needing treatment.
Hmm.
So when we have the opportunity to do that, a lot of times this happens in like with pregnancy and postpartum and exercise people, like you mentioned, people that are, really interested in their fitness and working out. Prevention is key. So, we have people that just want to have, maybe just a healthy pregnancy, or they don't want issues after they have their baby. And so prevention for them is key. So yeah, we have them come in. We'll do that full assessment because again, we want to see if there's areas that are maybe in that particular person a little prone to potential dysfunction, and
Well,
then work to establish a program for them, that individual, that
right.
will help um, um, dip in function or dysfunction as they're going through.
Great. Let's see. Kelly, can you still hear me? I lost you for just a second there. So what I heard was that people who are looking to prevent issues can come in and you can assess if there's any potential issues. It could be that they have high muscle tone or some weakness and things, and you can give them a plan to work on that. Can you hear me?
Abs. Can you hear me?
Yes, now I can. Awesome.
Okay. Ab separation, diastasis,
Okay.
pregnancy, postpartum. If we've got some pressure management issues that are contributing to some leaking with high impact. Did I lose you?
No, I cut my video off so that yours, I think I was just having a streaming problem. So I got you.
So like with high impact or high level of weightlifting, we might just need to tweak a couple of things when we see these people before they have a significant issue, and then they're able to get right back in the swing of things. But we assess people proactively for all those things, because quality of life is really what matters the most for a lot of people. So we want to help with that.
Awesome. Could you share any advancements or recent technologies that you find promising when it comes to pelvic floor physical therapy?
Yeah, let's see. I well, we utilize dry needling in our
Okay.
office also, and that to be really helpful. Red light therapy is kind of an emerging um, treatment modality and intervention that we found helpful for inflammation and
Okay.
things, that we have that in our office. Those are the two things that come to mind, but there's always research going on, but we always need more.
Yeah.
Um, but yeah, those are the things that I find are pretty helpful as far as like the kind of newer modalities, I guess you'd say.
Perfect. All right. Any last parting things you think would be helpful to someone who's considering pelvic physical therapy, but they haven't tried it yet?
I would say just do it. Um, we kind of are nervous about that. Like, am I a candidate? Will it help? Is it worth my time? All that. And just 1,000% yes. You will never regret getting an evaluation and assessment by a specialist, a pelvic floor physical therapy specialist, who is going to be able to really take a whole body approach. I highly recommend that and find out what issues are kind of unique to you. Everyone is different. Every body is different. And so having that assessment, you will never regret doing that. I say, just do it. You're never too young. You're never too old. The issue is never too far gone. We really provide hope and healing for all pelvises and all pelvic floors.
Oh, that's awesome. What a great way to like wrap it up. I love that. What's the best way for people to get in touch with you if they're interested in making an appointment?
Yeah, so you can call our office at 706-234-3932,
Okay.
or check us out on our website, www.pelvicpt.com. Those are probably the best ways.
Okay.
And you can email us. Yeah.
Perfect. Well, Kelly, thank you so much for your time and thanks for being on the pod or the show. I'm not sure what I'm calling it yet, but
Love it. Thanks for having me, Lindsey.
all right, awesome. Thank you, Kelly.
Thanks.